It would be you'd have to see whether like how the South. I just said a bunch of words and didn't say anything.
Hey, I'm Amar.
And I'm Matthew.
And this is Our Side of the Coin. Hey, welcome back to another week on Our Side of the Coin. It's me and Matthew again.
Hello.
And we're going to be talking about, not so much a debate today, but maybe we're just going to have a friendly discussion about how the healthcare systems are whack in the U.S. and maybe better alternatives, and maybe talking a little bit about Canada's healthcare systems too.
And also just talking about the way it works, because frankly, I don't know that much about it, and it's very complicated and also very important.
Yeah, I'm a dual citizen in the U.S. and Canada. I was born in the U.S. I don't have any residence in Canada, so I can't take any healthcare benefits from Canada. And likewise, I also don't have to pay any property taxes or any income taxes in Canada as well because of that, right? And so, yeah, I'll try to talk about the Canada side as much as I can based on what I see and what I've heard from my cousins.
And also, this will probably get political, so just keep that in mind as you listen.
Oh, and I think the other announcement that we wanted to talk about was that we're not going to be releasing every week from now. We're going to be releasing every other week.
Yeah, because if you haven't been able to tell, we haven't had ideas for like the past 3 months, and
we've had some ideas.
Also, we won't be able to record in the summer, and so this is a way to like have more time to come up with ideas, and also like stockpile videos for when we can't record.
And next week are the SATs, so we're probably not going to record next week.
Also, there won't be an episode next week.
This will be the week of.
There won't be an episode next week as you listen to this. That's the way time works.
Okay. So anyway, what do you want to talk about first with healthcare? You want to talk about the U.S. healthcare?
Yeah.
So what we were actually just discussing while we were trying to come up for ideas was the idea of, so it's a common scenario and it's a tragedy that it happens, but what happens many times is that a person or maybe their child or a loved one, somebody will get hurt, right? And basically they'll go to the hospital, and most of the times, because especially if you're making a median salary in the U.S., right, many treatments, depending on the severity, might put you back 6 figures plus.
Yeah.
Especially like rides to, like a simple ride in an ambulance for like 5 miles can be like thousands of dollars. And people can't afford that. So what ends up happening is they take a loan out, they get into debt. Most of the time they're not able to recover from the debt, and they grow up and try to save up and never really get a chance to live life because of debt.
And so the primary solution that we in the United States have come to is healthcare insurance. And so the way it works in America is it's all private.
Yeah.
Healthcare insurance. So you would pay.
There were attempts, Obamacare and the Affordable Health Care Act and the like, but sadly, current administration. And
Amar's use of sadly, and I would agree with him, might go into what side of the political coin we're on. Political coin.
Nice fun.
Yeah. So it's all private, and so in that way you can prevent having to pay enormous amounts of money by paying less money every month. The problem with that is even that is not...
it's not realistic for many, because I think an individual plan can cost like $300 a month per person.
It can be expensive.
And considering like with all the other bills that you have just to live, just to support a family and everything, sometimes it's not realistic. And people, there's fines if you don't get healthcare sometimes, or in certain situations, and people can't afford the healthcare, so they'll pay the fine, get even more set behind, and still not have access to healthcare.
Yeah, and because they're private, it's like it's not a free economy because there are regulations, but it's a market now, and that means that they're able to raise the price on healthcare because
the demand is like extraordinary.
The elasticity is very. Hold on.
It's very low.
It's very inelastic.
Inelastic because it's almost a necessity at this point. Ooh,
and then that transitions.
Econ from last year.
Transitions into the very obvious debate you've all been waiting for about whether healthcare insurance should be all private or whether
we
there
said
should
we're
be
not
government.
Debating today, Matthew.
No, but we're going to talk about it.
Okay, we're going to talk about it.
How are we going to talk about healthcare insurance? How are we going to talk about healthcare? We're not talking
We're
about...
having a friendly discussion on universal healthcare.
We can't talk about healthcare without talking about private versus government healthcare.
Okay,
and you can bring your Canada experience into this.
Yeah, so, I mean, I don't know wherever you want me to start. I can start with The U.S. side of it, I've been hospitalized a couple times in my life. I had appendicitis
Yeah.
one time. I had an issue with my nose the other time. Both times, thankfully, my dad has insurance through his work, right? Which is another thing we can talk about, how employers should provide like these kinds of benefits to their employees, especially for physical jobs where your employees' health can basically determine like their job. And also, many studies show obviously hiring and using resources to get new employees is usually more expensive than just training and keeping the old ones healthy. So yeah, the quality of healthcare, and what I've also noticed, especially in Canada, is that when you hear reports of like Canada healthcare, if you just look at news articles, you'll find that it's pretty common that people end up waiting like even in the ER, somebody with like severe like on the line condition, unless they've been brought in by like an ambulance or in like an immediate surgery or whatever, like that kind of emergency. But people entering into ER will be sometimes wait 8-9 hours just to get booked in because of how full hospitals are also all the time there. And because it's accessible to everybody, people are more willing to go to the hospitals if they get sick, whatever, and clogs it up a lot.
I don't know. I feel like the reason the emergency... I don't... See, this is why
sorry, I totally cut you off, but I think it's just important to note that Canada also does have still private insurers for people who can afford
There's
it.
a government option.
The government option is the default.
Yeah.
Like, usually only the elite class go for in private insurers.
It's probably more expensive because there is the government option, so it might be less regulated. I don't see. This is why we're not having a debate. Is because I don't know that much about the situation, and that might be unsatisfactory to listen to.
No, insurance. Well, I mean, it's just me explaining it, which is fine.
Problem.
But I mean, obviously, both of us are high schoolers, and neither of us had to pay the healthcare bills yet. I don't think so. We don't have as much experience with that. But basically, talk about the policies that we know or we're familiar with, or what we hear about every day in the news. Right? You hear about it pretty much every day. People get taken to the hospital and are suddenly charged $60,000, $120,000 for an airlift because they got stuck somewhere and they had no other option, and now they're 20 years old in college and severely in debt.
So going back to what you were talking about the Canadian healthcare, I guess the argument could be made that the quality would be less because the argument that is often made for private healthcare is that because of like the way it's set up, healthcare companies have an incentive. Healthcare insurance companies would have an incentive, and then also, okay. So and then the argument I was going to make is that means healthcare institutions have an incentive, but then what I was going to say is that doesn't really make much sense because healthcare companies would be paid either way, or clinics would be paid either way. Well, it's just a question of who's paying them.
Actually, that's a really interesting point because if you compare median salaries for doctors in the U.S. to doctors in Canada, doctors here make significantly more. And also, I don't know if it's more like me. Obviously, I'm going to be very heavily biased. I want doctors to make more considering I want to be a doctor. And the amount of schooling and training and everything that goes into it is far beyond what any other normal occupation would have, right?
And I think reasonably so.
Yeah. And so I think the compensation for it later in life might make up for it. But so what happens is, and I have a cousin who's a doctor, and he's complained about this multiple times. Because sometimes, even out of charity, doctors are human beings. They're not evil people trying to steal all your money from your entire life. But a lot of times, insurance will actually force doctors, like your insurance will force doctors to charge so that they can get the copay from you.
Because the insurance companies need money to operate. I don't really know enough about that, but if that's true, I could see how that's like a detracting from the private healthcare model. But what I was going to say is you said like the salary in the US is higher than the salary in Canada for the same profession. And what I would say is that there are a lot of factors that go into that
obviously.
Besides
healthcare is one of the biggest ones.
No, but what I was going to say is the economy, because they're two different countries.
Yeah, that's true. The U.S. economy is definitely stronger.
It depends on so that would mean that that salaries would be higher, and I don't know how much of that affects the salaries. It would be you'd have to see whether like how the salary. I just said a bunch of words and didn't say anything. You'd have to see what the salaries would be like if Canada had the same model as the U.S. and then whether they'd be higher or not.
Yeah, there's still a lot of factors that go into
Yeah.
it, like land and population
Yeah.
distribution is a big one. Because even in the U.S., you see in rural areas, doctors are
Yeah.
paid a way lot
And,
less, 'cause there's a lot less population to cater to.
And I mean, just in general, Canada has a lower population and
A very
much
low population density compared to the U.S.
in a lot of places. So
Okay, yeah. I guess another thing. Here's an opinion question for you. Would you pay? I think it's like. So let's say. What do you want to get into? Like engineering or something, right?
sure.
Okay, let's say hypothetically you're in engineering, you're making $100,000, let's say Canadian a year, right? Would you let's just say $100,000, right? I'm not gonna specify the currency. Would you rather pay? Because in that bracket, I think it's like almost 40% tax, income tax, maybe less, maybe 30. I don't know.
Mm-hmm.
I might be completely off with that number. I don't remember. I remember somebody telling me it's almost like around. It's a lot. It's like almost half. You can Google that actually. I want
Let
to
us
confirm.
Google that.
Yeah, we just Googled it. We'll Google. And it's around, depending on your bracket, but if you're making around $100,000, you're expecting to look at maybe, because it's like 26% in that bracket, and then the bracket before is like 22%. So around 20 to 30%, you're looking around there out of your income tax versus the U.S., which is probably around 10 to 15%. So it's almost like a half difference, which is pretty significant. And so are you willing to pay that many taxes? And especially considering careers, the more specialized you are, the more money you make, right? And the more money you make, the more goes to taxes. And you get where I'm getting at from that, right? It's a little bit more of a conservative view.
What I would say is that it depend. I might be more willing to pay for it because of the fact that the companies don't have to pay for the insurance, like from their revenue. Their profits aren't being eaten up by having to pay their employees healthcare, which means that they're able to give more salary, which might balance out the 30% of tax
Okay,
if the salary increases. And then again, there are
a lot of factors that we
so
don't know
I don't
about in this.
but that would be an incentive to still put up with the high income tax if your salary increases.
Right, and then obviously you still got the factors of how well a company is
And
doing.
also
And sorry, go ahead. I always pause and let you in. Go ahead. Go ahead.
Also, the thing interesting with that is in Canada, you have to pay for health. Healthcare is government, but that's funded through income tax. In the United States, often people get their healthcare from the companies.
Depending on your employer, and it depends
Exactly.
a lot on your occupation.
And lots of people work at a place because they provide healthcare and they can't afford it by themselves.
They also do dock it from your salary usually.
And
that's where that benefits come from.
That, and also that limits like the places where people can work. And in the other model, you're eliminating that factor.
Okay, I see that. So you're allowing for more successful business growth, essentially. Okay, I was just thinking because, like, you know...
But that also means that you get less of your salary.
Okay, well, I mean, I guess what I'm concerned with is that as you keep... Because the point of pretty much living in a country... Like, your goal is to be financially successful so you can stably retire by the end, right? Mm-hmm. Or not even just stably retire. Like, people move up through their occupations to get higher salaries to live better lives. Mm-hmm. Blah, 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 blah. If you have universal health care, right, for everybody... You could be possibly, providing. What's the word? I don't know how to articulate it.
I don't know what you're trying to say.
But it's kind of like communism. You know what I'm saying? It's not communism. It's not communism. That's not what I'm getting at. But there's an aspect of communism that is heavily.
You're talking about there's no incentive. There's no incentive for
there's no
improvement.
You can get rid of the communism stuff. That didn't make any sense.
Yeah. I mean,
there's no
universal.
There's not as much
universal healthcare
incentive.
is a more socialist idea because socialism is putting more control into the government in terms of the economy. So what you're saying is because don't have to.
I'm not arguing against socialism. I'm not really talking about capitalism, socialism, communism. I'm more talking about the incentive to continue.
There
to
would
be
be less incentive to continue to be successful because you don't have to pay for healthcare.
Because as you keep going, your taxes continue to get higher, and eventually, you keep, even though you may be working harder and maybe working longer, your salary is less and less and less as you go high. Yeah. I mean, it's a similar system in the U.S. We do have tax brackets.
Yeah.
That's how we work. It's just that our tax brackets are not as significant. That kind of allows us to, be like really successful towards the end of our lives. Don't get me wrong. There are definitely a ton of successful people in Canada too. Yeah, millionaires and such.
What I would say to that is, I guess I would agree, but you're still making more money. Yes, you're just making less more money.
Yes, less more money
than you would without the system, but you're still making more money, so there is still the incentive. It's just that the benefits are less, which might even be worse because there's you have less control over your own success, because you can get less success because you have less income compared to the
that makes sense. I guess the point of I think Obamacare, Affordable Health Care Act was pretty.
It's called Obamacare.
Whatever it's called, right? I think it was a good.
We're going political on this one.
Yeah, I know. I'm like hopping in and out of I'm putting my toes in the political water, right? I'm not trying to hop. Okay, I'm totally in it. I'm like diving in, but I guess it did a pretty good job of providing services to people who actually needed it, like people of higher status quo or of higher social classes who can actually afford insurance, full coverage insurance.
So I guess maybe instead of universal health,
and that way also the taxes for everybody also are a little bit less. They wouldn't be at the 26% rate that Canada charges. They would, but they also wouldn't be at our whatever 10, 12, 14, whatever we charge.
So I guess instead of having healthcare, universal healthcare or government funded healthcare as the default and having higher taxes to benefit that and all of the positives and negatives from that, you have universal healthcare more like an emergency plan, like a fallback if you can't afford or no other option will work, so that people aren't punished
even for... how colleges kind of do FAFSAs and stuff, more like a FAFSA but for medical.
Okay.
Yeah, I guess that's. I don't know, because me and my cousins always talk about this, and they're like, yeah, it's great because we can get hurt and we don't have to worry about paying thousands of dollars to go to the hospital or blah, 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 blah. They go, if they need stitches, they can actually go to the hospital. Many U.S. citizens, we live, sadly, in a situation, majority, because you only have that top 1% that's living, extremely comfortably. Mm-hmm. I don't know how, the middle class is definitely shrinking. That's what I've heard.
Interesting.
I've heard that the middle class is shrinking. I might be completely wrong about that. Don't hold me to that.
I've heard that the middle class is larger than ever before, which I think I might agree with. I don't know enough. I mean, I guess specifically in the U.S. also.
Yeah. I think worldwide the middle class is shrinking. I don't know. I have no claims for that. I have no evidence for that, so I don't know. I've heard that. But okay, let's say the middle class is staying the same, right? But even the same at the lower class level, you have people who get injured. Normally, those kind of jobs are physical jobs, right? If they can't work, they can't make money. If they can't make money, then they can't even pay their bills. You know what I'm saying? You get stuck in an infinite loop at the bottom.
Cascade effect.
I think something needs to be done at least for the bottom.
Yeah, there should be a net.
Yeah,
to catch
definitely.
Them.
That net. How would you? Let's talk about the net a little bit. Would you provide that net to a middle class?
The worldwide net?
That's World Wide Web, sir.
Webs can be nets. What'd you say?
Should that web or net? Oh, God damn it! Should that net be provided towards middle class, or does it depend on their salary really?
Well.
Or maybe it's like FAFSA where it considers how many people are in your family, how much money you're making, all those factors.
I guess it could be you have the government healthcare and you have the private healthcare, but you strengthen the government healthcare, but because we're talking about all the problems or the cons of government healthcare, the quality of service may be lower because there are lower salaries and longer lines because more people are utilizing it. And the way you get out of all of those negatives is you can switch over to the private healthcare if you have enough money.
Yeah.
And so it'd be a less extreme version of the fake version of Canada we're making up in our heads because we live in America.
Yes, America.
Yeah, the best place to live. Yeah, so it'd be a less extreme version of that where the government the government option is more competitive, but the private health, like if you were to choose one, the private healthcare option would still be better. And that
would the private healthcare sector get you access to better healthcare, or would it be in the same hospitals as everybody else?
In theory. Oh, okay.
You see what I'm saying? Right, because if I just realized that as you were saying it, a potential problem of that is
because
that
government
you'll have clog up.
Insurance is not clinics. I see.
But insurance also does make you still copay, so that does also reduce some of the congestion, but not as much. You know what I'm saying?
Yeah.
Let's see. Let me think about it for a sec. So I know, like in Canada, you can go to any hospital, any doctor. You have to be covered by the government, right? Yeah. There are no. I don't think. Maybe I'm wrong, but I'm pretty sure there's legal policies that do not allow doctors to only service like private health sectors or whatever.
And if there were, I wouldn't.
I do think that there are private hospitals which are still under government, but also provide some sort of like you need to pay extra to the hospital or something if you want to get service there. I don't know. I maybe I'm wrong because I remember reading something about the Prime Minister of Alberta falling sick and going to a private practice of some sort.
Well, okay. Well, who funds healthcare institutions now?
For
like in the United States, who funds healthcare institutions? It would be who would it be? It would be the insurance because
it's the doctors. It's whoever started that business.
Well, no, not who started it. Who keeps it running? Like, where do they get their revenue from?
Insurance pays,
and then a small fraction of people paying out of pocket.
Yeah.
Which is expensive. And then, so I guess one scenario...
Well, everybody usually ends up paying out of pocket for copays anyway. Yeah.
But the copay, like the idea of healthcare insurance is that the copay is like
minimalized.
A fraction of the actual healthcare insurance, of the actual cost. So I guess what I was saying is a scenario that you could have are two types of hospitals. And one in which one is like a government, almost basically government funded institution because it's funded through healthcare, which is funded by the government, and then like a private hospital at the same time, sort of like public versus private high schools, if I were to make that analogy.
Yeah, so like public versus private colleges more, because private colleges will charge you a lot more.
Public versus private college, I think is better. Yeah, sort of like that. But the quality gap couldn't be that big because
so you need to regulate the quality gap.
Because if the quality gap was too big, then you're back at one of the main flaws that people give of the private healthcare system is that people's lives are like the more money
they're not as valued in a more public sector than they would be in a private
it's sector. Like only people with money get
good
adequate healthcare. Then that's a risk you could run in this scenario.
Just like how people who go to the Ivy League schools based on their financial status tend to have better futures and higher starting salaries than their perhaps public university counterparts. Yep.
And I think like that scenario is unideal.
Yeah.
What do you like?
That your idea
okay, yeah. I think, but where the gap... Because also, who controls... like the quality gap, because it wouldn't be somebody with a meter.
It would have to be the government.
Nobody would be controlling
it's like how they control food quality.
No,
like
quality would be controlled by market factors, basically. Like it'd be like who gets like the reason that supposedly the government healthcare institutions in Canada have less quality is because they have less money. That would be the thing that would be regulating it, would be funding. And it wouldn't be somebody saying, oh, you can only have so good. Like, why would you...
Yeah, no, it would be... Yeah, you're right. Market, like, the market limit. And then... So you would have to... I don't know if the public versus private thing would necessarily work then with that quality gap.
Well, I mean, it's not like people are saying public schools are have to be worse than private schools.
No.
Why are public schools...
They're not even necessarily worse. There's a lot of reputation stuff that goes behind.
A lot of stuff outside.
Yeah.
That's
a separate debate.
Because that's like the value of the thing is not the intrinsic value, but here we're totally talking about the intrinsic value.
Yes.
So
the quality.
That's where the analogy falls apart.
Yeah. Okay. So I don't know. What do you think? Public. Last thoughts, because it looks like we're running out of time. Public, private, all public.
I think
because we definitely decided that we need to provide it like to the class that needs it more than everybody, right?
I think that it shouldn't be just private.
Shouldn't
I don't think that healthcare is a place where market factors should have all the control.
Okay, I can agree with that. Yeah, I think we should be providing better access to the lower class. We don't need to jack up our taxes to Canada level, but we also do need a way to regulate. Because afterwards, because regardless, in a free market, private stuff will pop up. You need a way to regulate how the public stuff will still run. Because I think that's what I'm getting. That's still a problem that we weren't able to talk about because we ran out of time. Yeah. Thanks for listening. Check us out every other week now. We're still on Spotify, Apple Podcasts, Google Podcasts, the works. All right, bye.